But WHO has always taken the stance that we are not mandating vaccines. People should be free to decide what's best for them. But we have strongly advocated that people, particularly people at risk, are prioritized and uh, provided with vaccines. So, because we know that the vaccines are life-saving, the vaccines are capable of protecting people from severe disease, particularly those who are elderly or who have comorbidity. So even as we congratulate the government on the implementation of the national vaccination days and on the progress in that effort, we continue to re-emphasize the importance of prioritizing and ensuring vaccine access to the elderly and the comorbid populations, particularly now that we are seeing the threat of Omicron in the world and the likelihood of its importation. And I want to reiterate that we still remain concerned that nearly 2.5 million elderly Filipinos have still not had even a single dose of COVID-19 vaccines. So we need to use this situation now and the evolving global situation to emphasize the importance of vaccination for the elderly and the comorbid populations, and to make sure that we protect as many of them as possible as early as possible. Thank you. WHO has right along said that this is a virus, is not airborne, right? It's close contact transmission. And that is why we emphasize that what is important is the physical distancing and the face masking and the hand hygiene. If we can ensure that those minimum requirements, those minimum public health measures are complied with, if we can ensure that people don't congregate in closed settings, the requirement for face shields probably at this point of time is not mandatory, because as I said, we are still looking at understanding the transmission dynamics of the Omicron variant. So I think it will be premature now to go there and say we need to reintroduce face shields, because we also know that there is significant public discontent on the mandatory use of face shields. So it's better to get public compliance with the measures that are there and take a risk-based approach to reanalyze whether we need to go into the use of face shields or not.